As a composition includes a pubic girdle, and the bone of a free limb, femur, tibia, fibula in leg, and the tarsal, metatarsal, phalanx in foot, the femur in thigh. Now let's take a close look at each bone of our lower limb. The first one is the hip bone. Here is the first bone. This is the right hip bone. You can see here, this is the right hip bone. Here is the left hip bone. This hip bone and the sacrum form our pubis. Pubis, yes. This is the anterior view of the right hip bone. We can see it consists of 3 fused bones. In baby, the 3 bone is isolated. However, in adults, in ours, the 3 bones are fused together and form one bone, the hip bone. We can see the 3 portions of the hip bone in different color refer to they come from different bone. Initially, the 3 bones grows respectively, and they formed together in adults. Here, this portion in yellow is illium. Yes, illium. The portion in red is the pubis, and here the blue is the ischiem. We will talk about it in detail. Firstly, we take a closer look at the illium of hip bone. Illium located the upper portion of a hip bone. We can see this linear elevation. We call it iliac crest. This elevation, rough elevation, is the tubercle of iliac crest. This process is a tiny, we call it span, anterior superior iliac span. Below it, this one is the anterior inferior iliac span. Here is the superior iliac. They are in compare to this superior. Here is the inferior. Okay, they are all anterior. This is the posterior, anterior, posterior. Okay, the posterior superior iliac span and the posterior inferior iliac span. This surface we call it gluteal surface. It provides attachment for gluteus. We will talk about the glutinous mechanism later. Here we can see a notch, great sciatic notch. Okay. This tiny spine is the anterior inferior spine. We had mentioned it. This is the surface laterally. We can see it. Internal surface here. We can see this is the external surface. This is the internal surface. Yeah, this fossa, we call it iliac fossa. Okay. here is the iliac tuberosity, and this smooth surface is the articular surface, which will articulate with the sacrum here. This line is the articulate line. Next, let's take a look at the ischiem. Here, in blue, is the ischiem. This is its body of ischiem. This is this sharp process is the ischiem span. This lesser notch is a lesser sciatic notch. This is the great sciatic notch. Here is the lesser sciatic notch. This bigger tuberosity we can see is the iliac tuberosity. When we're sitting here, it supports us. So that we can see the difference between these three bones. Just to help us to see their difference. They are derived from three isolated bones. In living body, they have the same color. Okay. Here is the ramus of ischiem. Ramus. Okay, let's take a look at this person in red. It's pubis. Pubis. The elevation between the ilium and the pubis is this iliopubic eminence here. It is the place these two bones fused, okay, where this bone and this bone fused with each other here. This linear elevation, we call it the pectin of pubis. Here is the pubic tubercle and pubic crest. This surface is the same facial surface. The right and the left hip bone fused with each other here. Here. This foramen is the obturator foramen. It's always covered with a membrane. We will see that later. Okay. This bone has two ramus. Here is the superior ramus, inferior ramus. This is the body of pubis. It has one body, two ramus. Okay. And we can see the pubis and this ischiem form this obturator foramen. Acetabulum. Here is the acetabulum. It is formed by the body of these three bones, the ilium, ischio, and pubis. This posteriorly, this three bones formed this acetabulum. This surface is a lunar surface, like it's like the moon. Here is the acetabular fossa. This notch is acetabular notch. Here, notch. Laterally or external view. Yes. We will talk. We will see that this acetabulum will articulate with the hip. Sorry, with the femur, with the head of femur. Okay, this acetabulum. Okay,